Hi, this is Dr. Payne Delivers. I'm here to talk to you about home births versus having hospital births. What I feel, what I believe, and why. What is recommended and why. I'm not here to make you feel shamed. I'm not here to point my finger at you. Whether I were to see you in the office or sitting across from this camera, this is a safe space. It's a safe space for you to give comments and for you to feel welcome. This woman had a home delivery and she had a complication of a shoulder dystocia. And she lost her baby as a result of that complication while having a home birth. I'm sorry. Please forgive me, bear with me. This is very hard. I have talked with many patients in a hospital setting as well as office. I've had people ask me quite often, Dr. Payne, do I have to have an IV? I don't want an IV. Do I need to be on the monitor the whole time during my labor process or while I'm being induced? I don't want to be on the monitor. Dr. Payne, can I deliver in whatever position I want? I don't want to deliver like this. Dr. Payne, I've had 1, 2, or 3 C-sections and I want to have a vaginal delivery or try for a VBAC. One of the first things I learned as an OBGYN resident physician when I was in training, one of my faculty members told me, OBGYN is special. You know why? Because we have 2 patients. We're the only specialty that has 2 patients. What is best for one patient, it may not be the best or what is desired for the other. This can make it challenging. It can make it challenging. When you develop a birth plan or when you are going through your prenatal care and you are just coming up with this amazing vision of how you'd like to experience your birthing process and your labor experience. Many of you choose and desire a home birth for many reasons. Maybe it's because a hospital setting scares you. Maybe it's because you just don't want an IV and all the interventions. It gives you anxiety. It makes you fearful. It makes you scared. And it might even make you angry. Maybe you want to feel like you have more control. Maybe you want to deliver at home because you have created memories in that home and you want to create memories with your family by giving birth to your children in that home. Whatever your reasons may be. On the flip side, maybe you choose to deliver in a hospital because you feel safer with your OBGYN doctor. Maybe you feel safer in that hospital because of the resources that are available to you. Either way, both of you have your reasons for desiring what you desire and for what you want. We're all different humans with different hearts, different thoughts, different feelings. But what I'm here to tell you is what you feel, your emotions, and what you feel represents your personal truth. But what you feel may not represent the truth. May be difficult to hear that, and I mean that from a place of love and care. But what I'm asking for you to consider is this: a shoulder dystocia, it's not predictable at all. At all. It's when the baby's shoulder gets stuck underneath the pubic bone at that moment of delivery. Incredibly scary, but it's one of a handful of obstetrical emergencies that can occur. And OBGYN physicians are trained. We're trained for the unexpected. You guys, we see the beautiful, the miracles, but we also see the scary and the sad. But we are trained for the unexpected. We are trained for the scary. We are trained for when things happen like that to intervene with maneuvers in order to quickly get your baby delivered. Maneuvers to help get that shoulder unstuck. It can be incredibly scary to have something like that happen at a home birth, something you didn't plan for, right? And again, a lot of emergencies, I don't think any emergency is planned. A lot of them are surprises and unexpected, but many patients may have risk factors that have beautiful, uncomplicated deliveries. And I've seen many patients who are low risk who have an unexpected, unplanned emergency that we didn't see coming. What I'm asking you to consider and a call to action, and like what this woman so bravely talked about in her video. Number one, understand human psychology. You will find information online to back up what you feel and what you desire. No matter what you think, you will find information to validate what you desire and what you think. Whether you desire a home birth, there are groups and many sources online that will validate and tell you to have a home birth and why. There are also resources online that will back up and tell you why to deliver at a hospital. Either way, your desires will be validated by what you look up online when you're searching for only the things that you want to hear and what you want to see. Please consider that you might not be searching for the things that you don't want to hear, that you might not be searching for the things that you don't want to see, because those things are scary. Those things cause anxiety, and those are things you don't want to think about. I'm very grateful for the patient that shared her video. It took a lot of courage and a lot of bravery for her to share that in a calm way. What I'm asking for you, if you're a new mom, soon to be mom, maybe you've had a baby before, maybe you are considering a home birth versus a hospital delivery and you're not quite sure. What I want to ask you is to consider this. As OBGYNs, we have two patients. You're two patients, you and that baby. I want to ask you to have the courage to look up the information that represents how you feel, what you think and what you desire, but also have the courage to look up the information that supports the flip side of the coin, maybe what you don't want. But I'm asking you to be open-minded and curious enough to hear and to truly see it. You must have the bravery to realize that both circumstances, having a home birth and delivering at a hospital, there are benefits to both. There are also risks to both. Delivering at home, like I mentioned earlier, you might be in a space you're familiar with, in a space that gives you joy, and a space where you feel like you're in control and you can do the things that you want. You're in an environment that you know. I can think of a million reasons why delivering at home would feel amazing and would be an incredible opportunity. I can also think of things that are scary, like having a shoulder dystocia, having postpartum hemorrhage, baby's heart rate going down and not coming back up, and precious time being lost trying to get to the hospital, and then the worst of all outcomes, what this woman experienced and having the loss of a baby. This could have been preventable. And don't get me wrong, dangerous things and poor outcomes happen in hospitals too. But many more do happen at home births. You have to be aware of the risks and benefits. And as long as you have truly researched the good, the bad, and the ugly, the ultimate decision is yours. It is your decision. And in a hospital setting, yeah, you might get an IV in your arm. I don't know anybody that wants an IV. You might have monitors on your tummy to measure and monitor the frequency of your contractions or to monitor your baby's heartbeat. None of it is to make you comfortable. I'm not going to lie to you. But it is to identify problems before it becomes emergent. Those things like an IV, I hope you don't need it. But if you start hemorrhaging or you need an unexpected emergency section, you might be scared, but in the end, you're going to be so grateful that you did. You're going to be grateful that you had that IV in your arm, not just for you to receive fluids, but to help and support your baby too. In case you need a blood transfusion, guess what? That blood transfusion may not be just for you. It may be what ultimately saves your baby's life too in that moment. The monitors knowing that if your baby's heart rate's going down, that we can see it in order to determine if a C-section is delivered or if you need oxygen or fluids, or maybe it's just a simple repositioning. You're going to be grateful for having those resources that we can intervene with resuscitative measures or intervene and be able to talk to you about it and let you know what's happening in order to avoid a situation to where maybe your baby doesn't survive or something as tragic as what she experienced at that home birth. But you might not be in the environment that you want, or ultimately the environment that you would be comfortable in. I'm just asking you to be brave enough to look at all options. You might know why you don't want to deliver at a hospital, but have you truly thought about the reasons why it might be a good option to deliver at a hospital? What are the benefits? Write the list. Write a list of both. I'm just asking you to be open-minded and curious, that you can truly communicate both in a non-biased manner before making your decision. You don't want to be surprised by anything. But if you're truly unbiased enough to where you can acknowledge both and then still make the decision at the end, maybe by talking with your midwife or talking with your doctor, if you truly know anything and you know everything, you've heard all the risks and benefits, it is still your decision at the end of the conversation. But at least you know the truth. The truth always lies somewhere in the middle. Again, to all moms, moms-to-be, women who have had a miscarriage, women who have lost a baby in the first, second, third trimester, or even at the time of delivery, my heart goes out to you. I promise you there are OBs and midwives who will listen to you and that you feel that you can connect with. Don't give up after just talking to one provider that you just feel you didn't connect with, or who didn't hear you, or that maybe you felt like you were being scolded by and told what to do. Speak to someone else. Try another. We're all human. We don't all connect well with everybody, but I promise you there are OBGYNs that will listen to you, that will have these conversations in a way that can make you feel that you're not being judged, that you just want to have an honest heart-to-heart conversation, even if you think a little bit differently. But at the end of the day, nobody should be surprised. We should all feel informed, that we have the education and information that we truly need to make the safest decision and the best decision. So at the end of the day, yes, I always recommend delivering in a hospital setting, because it truly, at the end of it all, is the only place where you're going to have the resources and the staff available for an unplanned emergency. You just won't have it at a home birth. And at the end of the day, that personally would be what's more important for me. But that's just my opinion. So, research, ask questions, be curious, be open-minded, and have a blessed day. This is Dr. Payne at your cervix.